want to thank Jonathan, and we now have about a half hour here for questions and begin our discussion. This is a good setup, I think, for the panels that are going to be coming. So do we have any questions? How are we handling internet questions? Okay, great.
And be sure you identify yourself when you ask the question.
Hi, my name's Kelly Dennings. I have 15 years of environmental experience, but I'm working on a master's in public health because I want to work at this intersection in particular. And I had the same kind of thought around infrastructure and as an opportunity under the new administration. So my question to you is, are we reaching out to the urban planners? Are they in these discussions? How are we trying to foster this relationship?
Oh, that's a great question. I know that every time that a health professional shows up in an urban planning meeting, they have been welcomed with open arms, and the urban planners have really been engaging and have welcomed the input. So there's a big group right now looking at Sustainable City Year, it's called, and it's universities partnering up with cities and doing service-based learning, doing assessments for urban planning. Some of those include health impact assessments. My class right now is doing one with a city nearby. So there is definitely a good engagement there. There needs to be more. I think the health profession needs to get out there more and start to engage. But I know that there is receptivity at the other end. And of course, Dave Kindig could tell you that the Robert Wood Johnson Foundation has big projects on exercise and livable communities. So I know that there's a priority, at least at RWJ.
Hi, Lynn Goldman, George Washington University. Thank you very much for that presentation, Jonathan. It was wonderful. With David Kindig and several other people, I co-authored a Vital Directions paper for the National Academy of Medicine that's actually available on the website. And this infrastructure issue is one of the ones that we addressed in our paper. And an issue of, as we're trying to figure out how to bring health into all policies, including policies around infrastructure, that there seems to be a need for us to consider how we actually train people who are going into public health and how we actually create opportunities in communities to actually involve public health in decision-making around infrastructure. And I mean, you mentioned, one of the dimensions of that, which is the walkability, or if you may, bikeability of communities to make it more possible for people to be active. But there's so many other aspects of that that are important. Our drinking water supplies that have been impacted across the country, the fact that we so often see infrastructure like roads addressed without paying attention to the things that are running under the roads, whether it's, the waste disposal, liquid waste usually under the roads, drinking water supplies, and also our energy infrastructure. And one of the things that I wanted to get your comment on, Jonathan, is in particular infrastructure around protection from severe weather events. I think that the science increasingly is pointing to the fact that we can attribute many severe weather events to climate change. And there's a recent report from the National Academies concluding that, and yet we're still very cautious, I think, as a community about being clear to the public about that. And I believe that's where much of the more immediate impact of climate change on health is being seen in the United States in particular. And how we can, of course, we have to be taking steps to make communities prepared for these events, to protect communities from floods and storms and severe weather. And at the same time, we need to somehow make the public more aware that there's steps that need to be taken on the longer haul to prevent these from becoming even more serious and more frequent. Your comments on that?
Oh, Lynn, those are all wonderful points. I think that my approach is that we should not be thinking either or. Either we adapt or we mitigate, and that it's a continuum of prevention, that we really need to be thinking that way. We need this two-pronged approach of being ready for what is already happening. And I'm glad you pointed out that new National Academy report showing that, in fact, some of these extreme events that for a long time climatologists are saying you can't blame a single event, you can't really attribute it to climate change. Well, now we can. We can begin to see some of these patterns of extreme events. Really, you can now do that according to this National Academy of Sciences report. We're getting there. But that it's really making those connections and understanding that these issues are interrelated, that in fact, that there's complexity when you are thinking about a road. Think about complete streets. Build a road, it's for walking, for biking, and for commuting by motorized vehicle safely. The other aspects, the ecological links, for example, for adaptation to sea level rise, you can build a seawall and hold the ocean back, but then you've killed an estuary or mangrove and you've destroyed fisheries for regions. So when you think about adaptation, I go to the first do no harm, right? And be thinking broadly and not very focused where you may have unintended consequences that are damaging. So this is where we need a very engaged, interdisciplinary approach to have expert perspectives at the table so that when you do one thing to protect something, you don't make something else worse. So we are absolutely at a time where we need better engagement across disciplines, across expertise, because we could get this wrong. We could do more harm than good in our adaptation in our adaptation efforts. But I do think it's a two-pronged approach. We need, to be prepared, but we also need to go upstream and be mitigating the root problem to reduce fossil fuel emissions at the same time.
Good morning. Thank you, Dr. Pats, for that great presentation. My name is Phyllis Meadows, and I'm with the Kresge Foundation. There was a slide that you showed, and I only caught a small glimpse of it. But what it suggested was that indoor air quality was contributing to more deaths than outdoor quality. And if I got the sense of that correct, my question is really about the issue of changing the narrative. As you're trying to engage folks into this discussion, you have an issue of indoor air quality being significant contributor to the adverse health effects that we see. Is it a threat to the narrative change? Is there a relationship? Or should we be trying to talk about these two environments in tandem, perhaps for the purpose of engaging a broader audience in this discussion?
Right. Thank you for that comment and your question. I think that depending on where you live in the world, the intervention will be different and the health benefit will be different. In poor countries where they're cooking with coal and with wood, and there's a lot of PM 2.5 exposure indoors, in those areas, moving up the energy ladder to cleaner fuels is important for their health. In the United States, I think that's a different benefit. I think we have more to gain with urban air pollution as we do from the indoor air pollution aspect. But in poor countries, especially in East Asia, there are huge gains to not just focus on transportation and electricity generation, but the indoor air pollution problem is enormous. It adds up over there. So I think depending on where you are in the world, the intervention will be different and the health benefit will be different. Thank you.
Hi, Ben Miller, Rand Corporation. I really liked your suggestions about how we need to engage with local leaders, but this is also a national and global issue. Do you have any comments about how we still engage at a national and global level and coordinate at that level while engaging at the local level?
That's a great question, and there are, Andy, you can chime in on this too, but there are people in the room who are going to be talking about that throughout the day. I'll just give you my opinion, is that we absolutely need to be better at communicating the truths that we know, or at least the best of science that we know, that tries to there's always some uncertainty, but to the extent that science moves us closer to understanding, we have to be more out there. We need to, I was very discouraged to hear the head of the EPA, his mentioning that he doesn't think there's a relationship between CO2 and climate, when actually there's a lot that we know about that relationship. And you've seen the study about the 97% of climate scientists not only say that, yes, there's warming, but it's attributed to human activity, mostly burning fossil fuels. And there's a National Academy of Sciences study of that study, and another recent, a huge majority of climate scientists say this is real. We need to keep that in the ear of the public. And I think we do need to be communicating much more and more effectively, and simply, so yes, pivot to local leadership, and also keep informing the general public and at the national level and international level.
Thank you.
Morning, and thanks for your presentation. Terry Allen from the Cuyahoga County Health Department in Greater Cleveland, and a member of the Roundtable.
I went to Case Western.
Oh, fantastic. Go Cavs. So there's been a lot of talk in urban planning as of late around tree canopy disposition and mitigation strategies. And so in public health, we've been doing a lot of work, as was suggested by George's Benjamin, around emergency planning and preparedness with greater frequency. I wonder if you could talk about the importance of mitigation strategies like tree canopy, opportunities to spread tree canopy, and thinking about that from a preparedness, public health preparedness frame, and perhaps its importance. Thanks.
No, thanks for raising that. I think that when you think about the urban environment where most people live, it's extremely important to be smart about our prevention there. And we may have the most to gain by interventions in the urban environment. I mentioned, the walkability, bikeability, increased physical fitness, but the aspect of greening our cities and having green rooftops, for one example. You have the issue of the urban heat island effect, where the asphalt roads, concrete buildings and asphalt roads retain heat, and you've got the urban heat island effect. So trees are really important as far as reducing the urban heat island. Trees are also, and green vegetation is good in reducing the increased rainfall runoff problem and contamination. So you've got, heat mitigation, flooding mitigation, cooling of buildings as far as planting trees at the right place and getting shade, and mental health issues. There's a new study that came out of Wisconsin even.
Even, right.
Yeah.
Please.
Yeah. that talks about the mental health benefit of green canopy. And even, it turned out that the green cover, canopy in urban environments was on par with affecting mental health as much as moving or divorce. That's pretty extreme. So green, having green urban areas is a mental health intervention. I'll say one last quick caveat about trees. I can't remember which species, but some trees give off more VOCs, which is a precursor to ozone smog pollution. Some trees also give off more pollen. So you have to, when you pick the trees that you're going to plant in the city, be thinking about which tree species you use, and make sure you don't put in more ozone precursors from those trees.
Dave, is that on? Dave Kindig, University of Wisconsin. Thanks, Jonathan, for your talk. Great to see two Badgers up there on the podium. Just two thoughts about the investment issues. I must say the return on investment data that you show is almost shocking, whether those investments could really return that much. And so a question about that is whether is there any work in the social impact bond space around those kinds of returns? I don't know if Paula Lance from our roundtable is here today. I haven't seen her, but we've talked about that in our own roundtable. But a lot of those have been in early childhood or in criminal justice space. So, and I don't think the returns are at that level. One other just question really is whether in, there's a lot of talk about moving the community benefit IRS requirement for nonprofit hospitals more in community benefit and true population health directions, and to the degree to which those efforts and plans, I mean, this is a question I don't know, are also seeing these kinds of investments as important parts of that portfolio.
So, David, great questions and comments. For the last one, I have to defer to Jeff Thompson, who can tell you that we just had dinner last night, and he was saying how they're reinvesting into the community, and that's where you can have great gains in health promotion and disease prevention. Regarding the other question, it's no surprise, really, the $30 versus $200. When you think about the EPA's Clean Air Act, they're required to do benefit cost assessments. And Lynn Goldman knows this better than anyone, that they found that for every $1 investment in clean air, there's a $30 return in benefit, or even higher. But at least a $30 benefit for every dollar invested. So with the air quality, those numbers, I think, especially with this new administration, are critical when they're talking about rolling back regulations. We need to understand how valuable those regulations are. But, so I think that this is where this has to get out there. I also saw that the EPA is wanting to do an assessment of climate change policies. Well, I'll bet you that they're only going to look at that left side of the equation and what does energy cost, and they're probably going to leave out the health benefits. So I think that's impetus for us to really get those assessments out there and get the public health issue on the table in those assessments.
Thank you so much for your presentation. Sandy Magnan from adjoining Minnesota, and I'm co-chair of the roundtable here on population health improvement. Two things. First, if you could talk more about the issue you raised about environmental refugees. I think you said in talking about that might be an increasing issue. And then second, thinking many policymakers or general public are skeptical about the changing climate or climate change. In your work, what perspective or science most resonates with people who maybe are skeptical, or what stories that you have heard, or a different framing that can help people understand the issue better? Thank you.
Wow, tough questions. Andy, I'll let you take it first about refugees. No, the refugee story, I think, is very difficult for me to answer. You know, what happened with the Syrian civil war, the fact that it was preceded by the worst drought in instrumental record, it's interesting, and it may be very important, but very difficult to tease out. But if you think about the physical attributes of climate change, sea level rise, coastal settlements, droughts, and movement there, you know, people will be pushed around a lot based on extreme environmental conditions. And I think simply that destabilization and people, you know, having to lift up, get up and move somewhere else, and either have no immunity to those diseases or bringing new diseases and having no shelter, all of those things are huge public health burdens. So I think that there will be forced movement based on extreme environmental conditions. What that turns into as far as refugees is hard to quantify, but I think it's something that we really need to keep in mind. The other question was about the framing, yes. So I think that number one, you know, the communication is that climate change, it's real, it's now, it's already happening, and it's solvable. It's here. You know, things are happening now. There's scientific agreement. There's no scientific debate. There's political debate, but there's no scientific debate other than a few outliers about climate science. So the climate scientists agree. It's real. It's happening now, and we don't have to wait for future technologies. You know, we already know. You know, you saw the price of solar coming down. Wind is competitive now. You know, it's not something we have to wait for. And so it's actionable. We can do something right now. So I think those are key messages to convey. The other thing, you know, I mentioned about the health benefits from climate policy. You could talk to people that don't believe in climate change. In fact, I had to give a talk, and they asked me, talk about the health effects of climate change without using the words climate change. It was not hard. You know, I talked about extremes in climate variability and water stress and heat waves. And so even if people are not on board with climate change, you can say, what is the intervention to mitigate climate change? What is it? It's reducing fossil fuel combustion, and it's also conservation of forests. But the big thing is fossil fuel combustion. So forgetting about climate change, looking at the rates all over the world in chronic disease, the increase in chronic disease, you know, and you know, between high meat diet and designing exercise out of daily routines, right there you could say getting to low carbon for any reason, but just getting off of fossil fuels, getting to more sustainable communities is health promoting. So, you know, the large benefits that I showed from reductions in fossil fuel combustion, you know, those benefits are not related to less climate change and less climate change health effects. Those are immediate benefits in, you know, better food quality, exercise promotion, and cleaner air quality. Those are immediate benefits from reducing fossil fuel combustion without mention of climate change. So those are my recommendations. Great question.
Nada Brillinger, California Climate and Agriculture Network. We're a nonprofit advocacy organization. And I wanted to come back to the federal question that came up earlier and actually tee off of some things you just said. I certainly appreciate the critical importance of science-based evidence and communication to the general public. And I think, though, that we have to confront the fact that we're dealing with a federal administration that's not influenced by those factors very much. And, you know, I can't stand the phrase post-fact era, but that seems to be what we're in, or that it's selective fact evidence. And so I am left thinking we have to do a better job of political organizing and political influencing. And so I would love to hear from you your reflections on that and your thoughts about how to move more assertively into that political space, maybe with some partners, maybe with some unusual allies. What's already happening in the public health arena in that regard? Where are the edges and where are the barriers to being, you know, to stepping forward even more strongly as advocates in the federal policy space? Thank you.
Yeah, very, very important. You know, I think that we absolutely need to find good partners and coalitions. Linda Rudolph is here with Climate and Health Alliance. You know, who's the most trusted profession in the United States? Nurses. I think physicians are second or third, but nurses, physicians, you know, the messengers are important. And I think that scientists, sure, scientists need to be better communicators, but scientists, as you said, they're not necessarily going to carry the day or convince people. And I think finding these new coalitions is extremely important. Absolutely. I also think, you know, it's not exactly to your question, but I think that we as a public health society need to support anyone who's disadvantaged. And I'm going to key in on one group especially that we should invest in, show compassion for, and that is coal miners. We should have a highly visible engagement and investment in coal miners, and job diversification. And you know, these are people that, you know, could be left behind or should be left behind as we shift away from coal. We need to be out there taking care of them and being very proactive about that. Not really. No. Okay, go ahead.
Okay, well, I'll just keep talking.
There you go.
Yeah, just
Hear
get
me
close.
now?
You're
Okay.
good.
I'm Debbie Chang from Nemours Children's Health System and a member of the Roundtable. Thank you for your presentations. I have two questions. The first is you haven't talked a lot about the impact on children, both short-term and long-term, and whether or not the return on investment studies have included that. I mean, it would be great, for example, if someone like a Jim Heckman would look at this and look at the long-run impact. My second question is about health equity. I mean, we've talked about the universal approaches, you've mentioned those, but are there targeted approaches that you would suggest to really deal with the health equity issues? So the first question is on children,
Sure.
The second one's on health equity and targeted approaches.
Sure, sure. Well, according to the World Health Organization, 88% of climate change impacts affect children. And you think about diarrheal disease, malnutrition, malaria, those are, you know, very climate sensitive, and they really hit children. In the United States, I think it's the asthma story is really important with the allergens. So, you know, children are certainly a vulnerable group to focus on. You can do that. As far as other vulnerable populations, you know, there are, as far as heat waves, it's the elderly as well, are not physiologically able to cope with heat compared to others. When you think about disasters, I mean, look at Hurricane Katrina. You know, who suffered the most? You know, it's people that couldn't afford to get out of town. So you've got poverty issues there that even within our own country, that was incredible how the people that were affected were poor. Again, another moral crisis. Well, I leave that to the director of Wisconsin State Health Department.
Yeah. Former, right.
Former.
Yeah, right.
Andy, you want to say anything?
No, I think I would say that's a question for the various panels. I think they'll talk about how that's gone. And we only have about 4 minutes left, so I'm going to ask the two of you to make your comments or make your questions, not long answers.
All righty.
Yeah.
So, George Isham, I'm co-chair of the Roundtable on Population Health Improvement and senior fellow at the Institute, Health Partners Institute in Minneapolis. This is maybe a simple question, maybe not. Building on the comments about frameworks that were asked by Sandy Magnan earlier, and then this comment from the woman over here about strategy. It seems to me that the conversation is often at the political level, and it's a very technical, scientific conversation, and there's somewhat of an opportunity for a lot of people not heavily informed by the science, and that's many of us who are not in this expertise kind of area, to not know how to evaluate either the very technical descriptions or the political environment. And one of the strategies that I've thought about as the Roundtable on Population Health Improvement engages other sectors for which we have no expertise is to ask, what are the top 10 things that we as non-experts ought to read and know about the environment in order to understand it at a level that's beyond the political, but certainly not engaging the very technical. And maybe you can't answer that today, but that may be a question not only for you, but for our sister roundtable to contemplate. But so far, your conversation has been very useful to me in terms of understanding some of these issues. Thank you.
Limit it to the top 3.
All right, so I'll just say quickly to that before I forget to the next question, that I think that the first thing we need to do is become expert listeners. And, we still get in a habit of being within our own expertise and not really listening to other languages. We need to, and so our engagement has to be much more participatory, and these are complicated challenges. And I think, we always talk about interdisciplinary, and, we hear that too often. I think it really is a systems approach that has to happen, and that involves better listening and better bringing together the right expertise around a table. Real concerted effort in that type of expertise, cross-expertise engagement.
Last question.
Maureen Lichtveld, Tulane University in New Orleans. And two things. One is I'm fast-forwarding us together to one priority, and perhaps the highest priority coming out of this workshop, and that is to increase the environmental health literacy, whether it's here, whether it's in New Orleans, or across the world. It is that will empower us. So I urge that as either our highest priority or right up there. And secondly, with the increased attention of looking inwards, we don't have to go to Syria to find environmental refugees. In fact, they live around me. When the bayous are retreating and we have less and less land and more water to go to, environmental refugees are just on the U.S. Gulf Coast. Thank you.
Thank you. Go ahead.
No, I'll just say, absolutely, to do anything, to make any progress, people have to understand the linkages. And so communicating these linkages is absolutely paramount. First order of business. Thank you, Maureen.
And as chair, I usually would start with a question, but I knew there'd be a lot, so I'm giving up my question, and I'll save it for later on. And I just want to thank Jonathan and the previous presenters for laying the groundwork. I think this has set up the panels that are coming very well, and now we're going to take a 15-minute break. And since we held to our agenda in time, I want to hold you all accountable, so be back here in 15 minutes. And I just want to say, for those who are watching this live streaming, there's more of you than there are of us here, so I want to be sure that you take the opportunity to type out a question. We appreciate the tweets that are going out, but we also would like to have your thoughts and questions and contributions. Thank you.